Welcome to myeyeacademy.com. I'm Professor Mahfouz Hussain from Pakistan. Myeyeacademy.com is a platform for ophthalmic teaching and is available on the website and YouTube channel. In this video, VHB, which stands for Video Handbook, Chapter 9, Section 1, will discuss the basics and classification of cataract. Human lens is a naturally clear structure located behind the iris. That's the iris, and behind the iris is the lens. Remember, it is non-innervated, so during the operation there is no pain when we are doing the cataract extraction. It is biconvex and it's avascular, so there is no bleeding during the operation from the lens. The cortex contains the fibers packed inside the lens capsule. So, inside the capsule there is cortex and the nucleus. The nucleus appears at the age of 20. So if you are doing cataract extraction before the age of 20, there is no nucleus. So you only have to aspirate the cortex. And the dioptric power of the lens is usually 21 diopter. What is cataract? Any opacity in the lens or its capsule is called cataract. Or in other words, we can say that the loss of transparency of the lens is cataract. Look at here, just behind the pupil, the lens has lost its transparency and has become white, so we call it cataract. Cataract is a blinding disease. It occurs everywhere, affects any individual, mainly affects the adults, and always requires the surgery. There is no medical treatment for the cataract. Cataract is the main cause of the global blindness, and same is true from Pakistan, is the main cause of blindness in Pakistan as well. Etiology of the cataract. Advancing age is the main cause for the cataract, which is called senile cataract or evolutional cataract. One can have a cataract because of some drugs like steroids, secondary to eye injuries, some systemic diseases like diabetes and other systemic diseases, and some eye diseases like glaucoma can cause the cataract, and it can be hereditary. So these are the causes of cataract. Let's discuss the classification of the cataract. In this slide we have got 8 different cataracts. Look at this brownish one, the whitish one, the small blackish one. This one is like a radial type. This is the center is the cataractus. Look at this is like a Y-shaped. This is irregular in shape. So all these are called cataract. Let's discuss how we classify them. You can classify them according to their location. So like this cataract is in the nucleus, so it is a nuclear cataract. This cataract is white, so it is white cataract. This is just behind the capsule, so it is subcapsular cataract. This is in the capsule, so it is capsular cataract. So you can divide them according to the location where they are. The second type of classification we use is the maturity. Now this is an early cataract, so we call it immature cataract. This one is mature cataract, and this first one is hypermature cataract. So you can use it classification according to maturity. Another classification is the age of onset. Like this one is congenital cataract, and this one is juvenile cataract. This one is adult cataract, and this one is evolutional or senile cataract. You can also classify a cataract according to the degree of opacity. So this one is a mild cataract, this one is a total cataract, and this one is in between the two, so it's a moderate cataract. You can classify the cataract according to etiology. So this one, Y-shaped one, is a congenital one, while this one is evolutional one. This cataract, which is irregular in shape, is traumatic one. So you can classify the cataracts by different ways. Normally in the clinic or clinically, we classify them according to either location or the maturity. So maturity or location is the main ways we classify the cataract. Let's discuss it in further detail in the coming slides. Look at this slide. This first cataract, it's a nuclear cataract. So according to the first classification of location, it is nuclear sclerosis, and it is hypermature or intumescent cataract. So normally these two classifications we use clinically, though we can call it an age-related cataract or a total cataract or evolutional cataract, but normally clinically we use the first two type of classifications, which is location and maturity. This second cataract, this one is a cortical cataract, and this one is a mature cataract. So these are the first two classifications are also used to classify this cataract, though you can use the other three as well. Now this cataract is just beneath the capsule, so it is subcapsular and immature cataract. So subcapsular and immature, though you may call it an adult, mild or secondary cataract, but that's not normally used clinically. Then this fourth one, this is a cortical cataract and a mature cataract. This cataract is nuclear sclerosis and mature. This one is subcapsular and immature, so we are using the location and the maturity classification. Now the last two, this cataract is a cortical one. This one is a cortical and it's immature, though you can call it a congenital or a total or evolutional cataract. Then this cataract is subcapsular or immature, though you may call it a secondary cataract because it is because of the trauma. Now the symptoms of the cataract. All these are the symptoms of the cataract, like blurred vision, increased difficulty with vision at night, glare, halos, double vision in the single eye, need for the brighter light, frequent change in the glasses, and fading or yellowing of the colors. Now look at the color matching. The border of this slide is white and the border of this slide is black. Now the black symptoms are because of the nuclear sclerosis, and the white writing symptoms are because of the subcapsular cataract, while the blurred vision is because of the both of them. Signs. The most common sign is the decrease in the visual acuity, and we measure it with the Snellen's chart in the clinics. Slit lamp allows you to see the cataract. With the help of the slit of the slit lamp, you can see whether the cataract is capsular, subcapsular, cortical, or nuclear sclerosis. So that's the way we see the cataract, and we classify the cataract by its location and maturity. Thank you very much for being with me at myeyeacademy.com, and please do give your feedback at www.myeyeacademy.com. Thank you.